Speaking during a recent event in Region 5, Minister of Health Dr. Frank Anthony encouraged citizens to make full use of the government's Universal Health Voucher program, which provides free access to vital medical tests at accredited laboratories across the country. The voucher, valued at $10,000, can be collected from any health center and redeemed at any accredited lab in Guyana.
Recently, the government launched a new program, and that program is called the Universal Health Voucher Program. And what is it that we're trying to do? We want every Guyanese to be able to come and get some simple lab work done. And we know sometimes people don't want to come to the government labs, so you have an option. We have enrolled every single laboratory that is accredited in Guyana. We have enrolled them. And so you don't have an excuse. Any lab you can go to now. All you got to do is take the voucher and you can go to any one of these labs and they will be able to do some tests for you. Now what are these tests? So we figure for persons 18 years and older that we want to know what's going on with their blood. So there's something called a complete blood count, right? And you can get that test. There might be some people, some of the men especially, they like to go out on Friday nights and Saturday nights and they drink a little bit too much. So we might want to know what's going on with their liver, right? So you got a liver function test that can be done. And if we're seeing changes in the liver, then we can advise you on what steps to take. There's something called a kidney function test that is also available. Because if our kidneys don't work well, then we can have problems with buildup of waste in our blood and so forth. So we want to make sure we do that. There's also thyroid function tests. We also have what is called a lipid profile. And if you have an increase of fat in your blood, this can also put you at risk for heart disease. And therefore, we want to make sure that people get tested. And if we're seeing those early signs, we can advise you on what steps to take so as to prevent that from happening.
The minister issued a special appeal to men, urging them to take advantage of the voucher to test for prostate cancer, the leading cancer-related killer among men in Guyana.
And for the men, we also have another test. It's called a PSA, a prostate-specific antigen. Now, some of you might wonder what is this, right? But when you think about cancer in Guyana, the cancer that is killing men is prostate cancer. And one of the first signs that we see is what we call a high PSA test. Now, most of the people when we see them in the clinic, when they come, they already got complications. So it's hard to do anything at that point. And what we want to do with this program is to make sure that you get tested, and if the PSA is elevated, then we'll work with you to take the next steps so that we can either prevent these cancers from happening, or if you already have the beginning signs of cancer, then we can take the necessary steps to remove it so that it doesn't develop into complications.
Dr. Anthony also highlighted the inclusion of the HbA1c test in the voucher program, which plays a crucial role in detecting prediabetes.
But this is a very good test. It's actually the gold standard to check to see if somebody got diabetes, or in common language we say sugar, right? And if we want to know if somebody got sugar, we can do this test. And if we do it, we can tell people whether they are about to get diabetes, that's called pre-diabetes. And if we find you during that period, then there are steps that you can take to prevent or delay yourself from getting diabetes.
The voucher initiative is not limited to adults. Dr. Anthony said there are tailored vouchers for children under 18, which include age-appropriate medical tests. Additionally, women can access vouchers to screen for cervical cancer. Kyle Rollins, the LRTVS NewsWatch.